Yep, here we go.
Okay. So we're going to look at, Chris, some of the items that we can find in our either medic units, minor wound kits, your red bags. So we'll start with some cleaners.
Okay.
So what I have here in my hand is an antibacterial soap, or what we call a green soap. Primarily we would use this to clean any wounds around the area, wiping away. So we would primarily put it in a kidney tray or some sort of basin, and we would grab some of these non-sterile, either 2x2s, 3x3s pieces of gauze, and we would use our forceps or something sterile and wipe away from the wound.
Okay.
So
Just want to take a picture. Just want to know what these gauzes look like in front of the camera here.
sure.
Okay. Just put that back there.
Okay, so that's our green soap.
Okay.
Another nice alternative that we do have is an antiseptic wipe. They come in individual packets. They are sterile.
Okay.
We would open them up, and just as a piece of gauze has 4 sides, so does this little guy here. So when we use them, again, we would have our gloved hands. We would take our wound, and a wound has 4 sides, and so does this. So we'd brush away with one side, rotate it, brush away with the opposite side, rotate it. This side, rotate it again. We would do the last side. So utilizing all 4 sides for all 4 sides of the wound.
Gotcha.
Nice and easy to use. What else do we have here? Some tape. We have some various sizes of tape as well as some different types. This here is either transparent tape or what we call transport tape. It's a nice, easy tape. Obviously you can see where it gets its name from. Okay, it's nice and sticky, as well as it's extremely simple to break apart and cut without having to use scissors or, God forbid, your teeth. Okay, and so 2-inch and 1-inch. Very, very nice for minor wounds and to keep anything that is possibly going to come undone. The other kind of tape that we do have is just called white tape. Not as sticky or as adherent as this clear tape here. However, it's again found in most units. Can be used again just for the same applications as this one, as well as some other ones. This one here we will use to tape somebody's head on a spine board if required. This tape, though, not as quite as user-friendly, but it does have a little bit of stick, but if you play with it too much, it's going to lose its adhesiveness.
Okay.
And you won't be able to use it again. So those are some different types of tape. Then we have different sizes here of either cling or roller gauze. This is again non-sterile. They come in large quantities, usually bags, not individually wrapped. And we would use this, for things like burns, to keep on either a gauze pad, to cover up possibly a cut that you put on some butterflies, to keep anything kind of away from any dirt or debris, with giving the patient some flexibility and not having them completely bandaged up from head to toe with something really big and bulky.
So that goes over the Band-Aid. Is that what you're saying? That's not the Band-Aid.
This is not the Band-Aid. This is what would go over the Band-Aid.
Gotcha.
Okay.
Okay.
What else do we have here? This here is a piece of rubber, okay, or what we call S-March, okay, extremely stretchy. Okay, this we would be using for somebody with an open hole in their chest, an open pneumothorax. We would cut a piece, not use the entire length. Okay, cut a square, just depending on how large the wound is, how big the square is, and then we would tape it on 3 sides, leaving the bottom side open.
That's right.
So that any air or fluids would be able to expel. Okay, but this is airtight, so it doesn't let any air go through the chest.
Gotcha.
Then over here we have some burn gel. Okay, this can go on any 1st or 2nd degree burns. Okay, and what this will do is remove the heat. In this little package, for a burn about the size, I don't know, a few inches wide, okay, stick a little bit of this on. You should be able to give more than half of this package to your patient, where they could apply it then during work, on coffee, lunch, break, and then even after that at home. 3rd-degree burns, this doesn't go on.
Okay.
Okay, the application of this, put a little bit on and put some gauze, a non-adherent pad, which we will soon talk about and I'll show you, and then we can use just something like this lovely cling that we just previously talked about to
Gotcha.
secure it to the patient's arm.
Gotcha.
Okay. A couple tools that we do have here, just a pair of small scissors for bandaging. Okay, any medical scissors, you'll notice that there is a blunt end on it, so we don't cut anybody. Okay, that's what these are for. They're nice and sharp. Okay, these would be used for cutting things, you know, like cling any bandages, tape if needed, those types of things. These here, this is a pair of forceps. They are locking, so you do have to push them out and to get them to open. So we would use this again to possibly hold some gauze that we don't want to touch, to wipe away and clean a wound, or to dry a wound, so that we're not contaminating any of the stuff that we are using with possibly some dirt on our gloves or from touching something else that might have been in our unit. Okay, moving on, I'm just going to put that one over there. These here are what we call butterflies. I'll just open one up here so you can have a look at it. So this here, there will be a sticky side, whoops, sticky side and a sticky side, and this little piece in the middle is not sticky at all. So how we would apply these, we would start from right, okay, put the right side on, pulling over to the left. The second one's going to overlap the first by about 1/4 of an inch, and then we're going to pull the opposite way, going from left to right.
On the second one? On
the second one.
Gotcha.
And then alternate again back and forth. That way when we're closing a wound or a cut, the edges don't overlap if we keep pulling from one end over to the other, causing a really nasty scar. So the more that we can limit that, the better.
Gotcha.
So these are butterflies. Rule of thumb, any more than 3 butterflies having to be used, we would have to send them to medical aid for sutures. Rule of thumb.
Sutures, what are sutures? Stitches?
Stitches.
Okay.
Yes. Okay. Another Band-Aid here that we do have is just a simple regular Band-Aid that I'm sure everybody has seen. Okay, so it's straight. You have your sterile piece in the middle. Okay, again, normally we would take off one side of the Band-Aid, putting it on the one side of the cut, and then we would pull the other side over.
Gotcha.
Okay, so no, we don't have to contaminate that nice and sterile part in the middle. This one here that we have next is what we call a knuckle. That one was half open. A knuckle Band-Aid. Okay, it's shaped kind of like a butterfly, if you will. Okay, how this one gets applied and the reason why it's called a knuckle bandage is we're going to pull this apart. Okay, I'm going to stick it on the knuckle that's injured. Pull this off. I'm going to be all bandaged up by the end of this. Okay, put on the 2 ends. We can pull this side over and put on the other 2 ends, and it has this open part giving mobility to the knuckle, allowing it to completely bend from as opposed to putting a whole bandage on here, then it scrunches up and it becomes very, very difficult to move.
Gotcha.
Okay, so that's why that is a knuckle Band-Aid. So that one's that one. This here is what we call an eye cup, used for removing dirt out of the eye, dust, debris, anything that was not forced into the eye that might be penetrating the eye. So there is a little line inside. Recommended use prior to using, take some saline solution that we have here. Okay, pour it into the eye cup, swish it around, clean it out, get all the dust, and then fill it up to the level that we see on the rim here, and then have your patient use it.
Gotcha.
Okay? And we use this twice to try and flush out the eye. Next thing here, we have some gauze. This comes in all different sizes. Okay, anything individually wrapped like this is completely and 100% sterile use. You always have somewhat of a peel open system that you would use to remove the gauze. This one here is a 4x4. You can get them in 3x3s, 2x2s, all different sizes. They look very similar to the gauze that we previously looked at over here. So we would open this up like this, you'd be able to use it, and it's a perfect, nice little square. Okay,
but there's little holes
sterile.
in it though, eh?
There are little holes in it, yes. Okay, anything, if you are going to use this, it would stick to a wound that is bleeding.
Okay, so but she mentioned in the beginning that we could put that on the wound in the beginning, but afterwards, when it stops bleeding or when we're ready to bandage, That's when we use the telephoto, which I
Yes.
guess we're going to talk